What if I told you that after age 70, some of the most routine medical checkups your doctor recommends aren't protecting you at all, but may actually be pushing you closer to unnecessary surgery, lifelong complications, or even cancer? That may sound extreme, because for decades we've been taught one simple rule: the more tests you do, the safer you are. But modern medical science is now revealing a very different truth, especially for seniors. A large-scale review of senior medical care revealed something that stunned even experienced physicians. Researchers found that up to 37% of medical tests performed on adults over 70 lead to unnecessary treatments, including invasive procedures, long-term medications, and complications that do not extend life or improve daily function. Even more disturbing, nearly 99% of seniors are never told that they're being over-tested. Once a test shows anything outside a narrow normal range, it often triggers a chain reaction. More scans, more referrals, more fear. And suddenly, you're on a medical path you never needed to be on in the first place. And one of the checkups on today's list, the one I'm saving for last, has been linked to nearly 5% of all cancer cases in the United States, a risk comparable to drinking alcohol every single day. You will not hear this during a routine clinic visit. You will not see it advertised in a hospital brochure, because the truth is buried in the science. In this video, you're going to learn 5 health checkups you should seriously reconsider after age 70. Not because doctors are trying to harm you, but because many of these tests were designed for younger bodies and can backfire in older adults. For each one, I'll explain why it looks harmless, what the real science actually says, and how it can quietly reduce your quality of life instead of protecting it. Everything you'll hear is backed by real medical research, not opinions, not internet rumors. And make sure you stay until the end, because number 2 on this list is one of the most commonly recommended tests for seniors, yet the data behind it has shocked even veteran clinicians. Coming in at number 5 is a test that creates enormous fear in seniors: the brain MRI ordered for mild memory loss. If you are over 70 and sometimes forget names or misplace items, that can feel alarming. So doctors often respond with an MRI. But here's the truth. In adults over 70, brain MRIs almost always show age-related changes, even in people with completely normal thinking. A 2021 review in Neurology Today examined over 3,000 MRIs in seniors with mild memory concerns. 86% showed abnormalities, but only 3% required actual treatment. That means most people were told something looked wrong when medically it wasn't. Those findings often trigger anxiety, more testing, and sometimes invasive procedures without improving memory at all. George, a 74-year-old retired engineer, panicked after his MRI showed white matter changes. He stopped driving and socializing. A proper cognitive screening later showed his memory was normal for his age. Once fear was removed, his symptoms stabilized. Unless there are serious signs like seizures or rapid decline, a simple cognitive test is usually safer and more useful than an MRI. Number 4. Bone density scans, or DEXA scans. At number 4 is a test that sounds completely harmless: the bone density scan, also known as a DEXA scan. It's quick, painless, and often described as just a precaution. But after age 70, this test can quietly do more harm than good. Here's why. Bone density naturally declines with age, so in seniors, DEXA scans almost always come back showing low bone density, even when fracture risk is actually low. That label often triggers medications like bisphosphonates, which can cause serious side effects, including severe acid reflux, esophageal inflammation, and in rare cases, jawbone damage. A study in the Journal of the American Geriatric Society followed women over 70 and found that treating mild bone loss reduced fracture risk by just 0.3% over 5 years, while side effects were far more common. Rose, a 76-year-old who had never fallen, was started on bone medication after a scan. Within months, she developed severe acid reflux and jaw pain. When medication was stopped and she focused on strength training, balance, and vitamin D instead, she regained function without fractures. Unless seniors are not falling or breaking bones, exercise, balance training, and nutrition reduce fracture risk far more effectively than medication driven by a scan.
Number 3. Cardiac stress tests. Number 3 is one of the most commonly ordered tests for seniors, the cardiac stress test. It's often recommended for mild fatigue, vague chest tightness, or simply to be safe. But after age 70, this test has a major problem: false alarms. In older adults, stress tests can falsely suggest heart disease up to 40% of the time. That often leads to invasive follow-up procedures, angiograms, stents, even bypass surgery, without improving survival or quality of life. A major study in JAMA Cardiology found that more than half of stents placed after stress tests were done in patients who had no clear symptoms and gained no real benefit. Raymond, a 75-year-old active walker, mentioned mild fatigue at a checkup. A stress test led to a catheterization and a stent. That night, he developed kidney injury from contrast dye and spent nearly a week in the hospital. His fatigue never improved because his heart wasn't the problem. If you're over 70 and don't have classic symptoms like chest pain with activity or significant shortness of breath, a stress test may do more harm than good. Safer first steps often include a resting EKG or a coronary calcium scan, tests far less likely to push you into unnecessary procedures. Number 2. Colonoscopy after age 70. Coming in at number 2 is a test most people never question: the colonoscopy. While colon cancer screening saves lives in younger adults, after age 70, and especially after 75, the risks rise sharply. The preparation alone can cause dehydration, dizziness, and kidney stress in older adults. Sedation increases the risk of confusion and heart rhythm problems. A large study in JAMA Internal Medicine followed over 1.3 million Medicare patients and found that in people over 75, only 2 lives were saved per 1,000 colonoscopies. More than 20 people suffered serious complications. That's a 10-to-1 harm-to-benefit ratio. Dana was 73, healthy, and had no symptoms or family history. During a routine colonoscopy, a small polyp was removed. That night, she suffered a bowel perforation and spent over a week in the hospital. For many seniors, stool-based tests done at home, like the FIT test, offer a safer alternative. No preparation, no sedation, and far fewer complications. The key question to ask is simple: what happens next if this test finds something? Because once you enter the colonoscopy pipeline, it's often hard to step back.
Number 1 most overused and most dangerous checkup for seniors: the annual full-body CT scan. These scans are often marketed as advanced prevention or part of executive health packages. But here's the truth the ads don't tell you. A single full-body CT scan exposes your body to high levels of ionizing radiation, the equivalent of hundreds of chest X-rays at once. And for adults over 70, this radiation doesn't just add up. It can trigger a cascade of harm. A 2023 modeling study published in JAMA Internal Medicine estimated that up to 5% of all cancers in the United States may now be caused by CT scan radiation, a risk on par with drinking alcohol every day. Even worse, full-body scans often detect tiny nodules, cysts, or calcifications that are completely harmless and common with aging. But once they're seen, alarms go off. More scans, biopsies, specialist visits, and sometimes surgery, all for findings that never needed treatment. Marcus was 80, active and felt great. A full-body scan found a tiny lung nodule. It led to further imaging and a biopsy. The result was benign, but the biopsy collapsed part of his lung, putting him in the hospital for weeks. Medical organizations are clear. Full-body CT scans should never be used for routine screening in healthy adults. If symptoms exist, targeted imaging makes sense, but scanning the entire body just in case often causes more damage than disease ever would. What this really means for you after 70. Modern medicine is powerful, but more testing does not automatically mean better health, especially after age 70. Every test should answer one simple question: will this actually help me live better or longer? If a checkup is likely to lead to more fear, more procedures, more side effects without clear benefit, then it may be time to pause. Real prevention after 70 doesn't start with scans or machines. It starts with staying physically active, eating well, sleeping deeply, and choosing medical tests carefully, not automatically. Always ask your doctor, what happens next if this test finds something? Are there safer alternatives? What are the real risks at my age? Sometimes less truly is more. Now we want to hear from you. Have you or someone you love ever gone through a medical test or treatment that later turned out to be unnecessary? What happened? Share your experience in the comments below. Your story could help someone else avoid the same mistake. Thanks for watching.